Good morning, everyone. This is Tirishik, third year BDS student. Today I am going to speak about important but overlooked aspect of dentistry, that is sounds and sensations in dental practice with special relevance to endodontics. In dentistry, fear is rarely about the pain. It is actually more often about the anticipation of pain that is triggered by sounds, vibrations, and unfamiliar sensations. The moment when the patient hears the high-pitched noise of the handpiece, the anxiety of the patient begins. This is common across all the dental treatments and procedures such as scaling, treatment, extraction, and all. But it's more significant in endodontics, where the patient actually comes to us with a fear of root canal treatment. From an overall dentistry perspective, patients are exposed to several sensory stimuli. The sharp whistling sound of high-speed handpiece, the humming of rotary instruments, the buzzing of ultrasonic scalars, continuous suction noise, water spray and cooling sensation, smell during tooth preparation, pressure during extraction or obturation. In most cases, local anesthesia effectively eliminates pain. However, vibration pressure can still be perceived, and patients often mistake them for pain. This misunderstanding increases anxiety, muscle tension, and sometimes sudden movement in the dental chair. Now, when we narrow this to endodontics, these sensations become even more important. During access cavity preparation, the high-speed handpiece causes loud noise and significant vibration. During cleaning and shaping, the rotary endodontic motors creates mechanical humming sounds. During irrigation, irrigation brings out a sensation of coolness and movement of fluids inside the tooth. Rubber dam placement may feel unusual and tight. During obturation, the patient may feel pressure when the gutta percha is compacted. All these are completely normal, but the patient may interpret this negatively if they are not prepared. That is why pre-procedural information must be given to the patient before every dental procedures. The first technique is called as tell, show, do method. We should first tell the patients that sir or ma'am, we will feel vibration and sensation, but that is not pain. That's not pain. It's completely normal. Then we should take the handpiece and place it at a distance and show them how it's working, how the sound it creates, how technically it performs. Then we gently proceed with the procedure. Second, the language matters. Words like drill, needle may increase the fear of the patient, which rapidly cause the patient to feel they are going to suffer, they are going to undergo something badly. But if we replace those kind of words with something more simpler, more softer, like water spray, like that, the anxiety of the patient is going to reduce significantly, which may allow us to do the procedure more confidently and more comfortably. Third, we must differentiate between the pressure and pain. Especially in endodontics, the difference between the pressure and pain builds the confidence. Builds confidence. When the patient was able to differentiate that this is pressure only and the pressure is normal, then the patient may remain calm throughout the procedure. And fourth, it must give the patient a sense of control. We should tell them that if you feel some pain or if you sense any discomfort, just raise your hands like this. This gives a psychological safety to the patient, which reduces their panic level and which makes them more cooperatable for the procedure. Distraction techniques like playing music, guided breathing, playing some video series, movies during the procedure when the patient is undergoing the treatment can be beneficial in anxious individuals. Short-term appointments and confident handling by the doctor, the operator is beneficial. Ultimately, dentistry is not the technical science, not just the technical science. It is also a behavioral management. A relaxed patient allows better concentration, improved visibility, and safer procedures, particularly in delicate treatments like this root canal treatment. In conclusion, while sounds and sensations are unavoidable in dentistry, fear is preventable. Through effective communication, reassurance, empathy, and proper patient preparation, we can transform the dental experience from something frightening into something manageable and comfortable. Thank you.